Okay, good morning, good evening, doctor, nurses, and pharmacists. I was just doing one or two role plays with one of my students, and just I wanted to go online so you people can also get benefit. So, doctor, this is your role play. Like in the real exam,
Mhm.
you will have 2 to 3 minutes to prepare, and then we will start the role play. Okay, so from
Sounds
now
nice.
you have 2 to 3 minutes. 2.5 is enough minutes to prepare. Okay,
Mm.
those who
Okay.
are with us on Facebook, so first the student will prepare, and then we will do the role play, and then I will provide the feedback. Just to tell those who are with us on Facebook, just the student is preparing the role play, then we will do the role play and I will provide the feedback. So please just wait 2 minutes almost.
Okay, can we start?
Just 1 minute, please.
Okay.
Okay, start, please.
Hello, good evening.
Good
My name
evening.
is Dr. David, and I am your treating physician today. May I confirm your name and age, please?
Yes, doctor, I'm Smith and I have uh, 70 years.
Oh, nice to meet you, Smith. So, if I am not wrong, today you presented in our hospital with complaint of some facial weakness, and there is some also some weakness in your limbs, if I am not wrong. So can you please tell me more about your symptoms?
Yes, doctor, uh, yesterday I was doing my routine work
Oh, nice.
and I suddenly felt weak on my right side, my face and my limb, and I was
Okay.
also having some slurred speech.
Okay, I am so sorry to hear that. Can you please tell me the duration? For how long are you feeling this?
Uh, Doctor, it lasted for 10 minutes.
Okay, okay. So, any associated complaint with this? Like, do you have any vomiting?
No.
Okay. So, can I ask you some further questions? They might be some personal questions.
Okay.
So, do you drink alcohol or do you smoke?
Yes, doctor, I smoke one pack per day for the last 20 years.
Okay. Do you have any history of increased blood pressure or increase in the cholesterol level in your blood?
No, no. Yeah,
Okay.
some one time I went to my GP and they told my blood pressure was high, but
All right.
not like, routinely I have high blood pressure.
Okay. Do you take any medication for this increased blood pressure?
No, doctor.
All right. So I need to tell you that for the diagnosis of your condition, we need some blood tests, and these blood tests include full blood count, and we need to see your blood sugar levels as well as cholesterol, and there is a gland in front of the neck, and we need to check either it is secreting more or less hormone, and in addition to that, we need to do an ECG and a CT scan of your brain. Uh, are you getting me so far?
Yes, yes. Are these tests necessary, doctor?
Yes, for diagnosis of your condition, we need to perform these tests. All right. So the CT
Okay.
scan will be performed at your brain.
Yeah.
Okay. So
Mhm.
I hope that you must have listened about this already.
Yeah, yeah.
Okay. So basically, we are suspecting a transient ischemic attack. We call it in medical term. And for you, we can say it is a mini stroke. So I will brief you about this condition. If in transient ischemic attack, there is basically loss of blood flow to brain, but it is temporary. Okay,
Okay.
is it making sense to you so far?
Yes, doctor. So you told me I am having a mini stroke.
Yes, exactly.
Doctor, I'm really worried if it is a mini stroke. I
Yeah.
might have any big stroke, any major stroke in future.
All right. All right. For that purpose, I appreciate your question. So you don't need to worry. We can avoid that in future with the help of medicine and with the help of some preventions. So I will guide you about the treatment and as well as the prevention. Okay.
Okay, doctor.
So regarding treatment, you need to take some medication that that is required for thinning of the blood. Okay.
Okay.
So it includes two tablets. One is aspirin and the other is clopidogrel. Okay.
Okay.
And for lowering your cholesterol levels that are a risk factor for this mini stroke, you need to take a tablet that is called Lipitor. And these medications you need to take lifelong.
Okay. Okay, doctor.
Okay. Yeah, and for the prevention of this mini stroke in future, you ought also need to do some modifications in your lifestyle. Like I will encourage you to do daily exercise as well as avoid fast food and junk food and take some healthy diet. Okay, and for the purpose of your health, you also need to quit smoking. We can offer you help for the stopping of smoking. Okay, we have social services, we can offer you that as well if you want. So
Okay, doctor.
can we summarize what we have gone through so far?
No, doctor. Okay.
Do you have any queries left?
No, doctor. Thank you.
Okay, thank you so much.
So 5 minutes and 30 seconds of role play almost.
Okay,
So you can be a little bit more concise at the end.
all right.
just over becoming, little bit in
Okay.
the smoking and these things a little bit.
All right.
So people on Facebook who are with us, what should be the score for this role play? What do you think? What should be the score? So, Doctor, just could you please tell us what you have done so far to prepare for your speaking?
To be honest, this is my first role play,
Yeah.
and I have done nothing. I have nothing in preparation for that.
Okay. Any videos, any help from your friends?
Uh, no, but I have the exposure of Royal College exams. Other
Okay.
than that, I have never
Okay. So
practiced.
it's very good. It's very good role play. It's very good. Okay. So you will easily get B grade. Okay. Even good B grade. So this is the thing that you people who are with us on Facebook also, you people need to be aware of that. When you're talking to the patient, you should talk like you are talking like to a child, okay? A
Mm-hmm.
a child, okay? So go step by step, ask one thing, go for the next, go for the next, okay? So we need to do like this. So many students, those who are new to OET or any other medical exams, OSCE exams, so they just do, keep talking and talking. They don't involve the patient in the conversation. This is one thing. And other thing is just, they give a very long explanations. They are not concise. They are not to the point for the reader. So these things make it difficult for the reader to understand what you are saying, okay? And we are the doctors, we know a lot of things. For example, so we know what is the prevention for this, what is the treatment for mini stroke. So we know as a doctor, as a nurse, we know all of these things. But when you are talking to the patient, these are quite new things for the patient. The investigations, the diagnosis, the explanation of diagnosis. So all of these things are quite new for the patient. So we need to go step by step, okay? Slowly, gradually involve the patient in the conversation. So we need to do all of these things to get, B grade. Even this doctor have not done any role play so far. Exams in just one day, in 2 days. So, but your speaking is very good. Okay. So the reason is you follow the patient, you involve the patient, and you go step by step. You talk according to the patient's level. So these are very good things. Okay. So, doctor, from the start,
Okay.
okay. So it's not like Royal College exams. So here you
All
don't
right.
need to say, if I'm not wrong, you are here for uh, facial weakness, limb weakness, and slurred speech.
Okay.
So it's okay for those exams. For here, just ask the patient, introduce yourself. Okay, ask
Okay.
patient name if you are not asked during preparation time. You can ask the patient's name during preparation time and ask that, and then ask, could you please tell me how can I help you today?
Okay.
Okay, just open question. Don't
Okay.
say I can see that you are here for this and this. This is okay for other exam, medical exams, but here just open
Okay.
question. How can I help you today? Patient will tell you this. And
Got
then
it.
we will ask an open question. Okay, Mr. Smith, I'm really sorry about that.
All right.
Uh, Can you hear me? Can you hear me?
Yes. Yes.
Sorry, I got problem with my internet. Okay. So, so talking about the question about duration, you said, are you feeling, how long are you feeling like this? Okay. So it was a little bit in the past. So for how long did you feel? It would be better question. For how long did these symptoms last? It would be good question. For how long did these symptoms last? Okay. So then, uh, mm, No must have. Okay, so when you ask me, when you explain me the diagnosis is okay. The
Mm-hmm.
way you have explained is okay for medical exams, but
Mm-hmm.
here for in OET, mostly what we use is okay. So from the symptoms that you have told me, Mr. Smith, I am suspecting that you have a condition that we call as transit ischemic attack, TIA.
Okay.
Okay, so ask the patient, do you have any idea about that? Do you want me to explain what is TIA like this? Involve the patient here and then explain.
Mm-hmm.
It would be a little bit better. It will give us more marks. Okay.
Okay.
So you said for lowering cholesterol, for lowering, no, to lower, to decrease cholesterol level, and the last, don't make it too long. The prevention, just keep it to the point. Okay. So now let me show you another role play.
Mm-hmm.
Just 1 minute, please. So, doctor, this is your second role play.
Okay.
2.5 minutes to prepare, please.
All right. Mhm. Contain of Leon is highly. It has channels and color. Chain Sriman Shara for the assembly.
You can mute if you wish.
Okay.
Can you hear me, doctor?
Yes, I can hear you, but I cannot
Sorry, I
see the role
got
play.
problem with it. I got a problem with internet. Yeah, can you see now?
No,
Just let me. No.
now I can see.
Okay. Just 2.5 minutes to prepare. Just those who have just joined us, the student is preparing the role play for 2 minutes, and then uh, we will do the role play, and then I will provide the feedback. Let me know, doctor, when you are ready, please.
Okay, I'm ready.
Okay, start, please.
Okay, hello, good evening.
Good evening.
My name is Dr. David, and I am your treating physician today. May I confirm your name and age, please?
Yes, doctor, I am Bashir and I have 60 years.
Okay, nice to meet you, Bashi. How can I help you today, Bashi?
Uh, Doctor, I am here because I have some lesion on my head. I am really concerned about that.
Okay, don't worry. Can you please tell me more about this lesion? I want to ask, is there any change in the size or in change in the shape, appearance, any change in the borders of the lesion? Can you please elaborate to me?
Yes, doctor, for the last 3 months,
All right,
I have noticed some, changes in the shape, and my wife told me that this lesion is increasing. Okay,
okay,
and also it was a little bit pale, like white before, and now it is becoming dark.
okay, okay. So, any idea about the uh, borders or anything coming out of this lesion, or do you have itching or irritation over this lesion?
No, doctor.
All right. So, do you have any exposure of ultraviolet rays in the past, or do you have prolonged sun exposure?
Doctor, when I was, young, I was a beach boy.
All right,
So I used to go to beach with my friends and enjoy there in the sun, but
all right.
not nowadays.
Okay, okay, that's fine. So, Mr. Bashir, do you have any idea what it could be?
Uh, no, doctor, I just think it is something um, something benign like that. But I want to know what you people can do for me.
Yeah, and you also have the
Just one more thing,
history.
doctor.
Okay,
Yes,
yes, please, please.
yes. Just doctor, my wife told me that I'm becoming thin and my pants are becoming loose, and I think I have lost 4 kg weight also.
Yeah, I'm so sorry to hear that, Mr. Bashir. And as you might be having an idea that it is a danger sign. Okay.
Danger sign?
Yes. I mean to say that this skin does not look unfortunately benign, and I wish I have a good news to tell you, but this lesion is malignant, Mr. Bashir. Hello, hello.